Hi, I'm Kirsten Matheson with the Public Information Office, and you're watching Caldwell County Today. And I am joined with a special guest, Miss Brittany Bond from Helping Hands.
It's good to see you, Kirsten.
Thank you for coming in today.
Thank you.
You have something called the Worker Wellness Program.
Yes.
You want to tell us about today?
Yes. So at Helping Hands Clinic, we're the free clinic and pharmacy that serves uninsured adults in Caldwell County. And part of our outreach is looking at ways that we can support not just the uninsured adult population in our community, but also our business partners and community. And through that, we looked at, with insurance prices going up and insurance plans becoming more expensive for employers, and then of course becoming more expensive for their employees as well, we were like, how can we connect with people who maybe can't afford the insurance plan that's offered at their employer? How can we support businesses who want to invest in their employees' health care, but their employees maybe can't afford their service or choose not to because of the expense.
Right.
And so that was kind of how the Worker Wellness Program was born. This is our opportunity to collaborate with local businesses and to be an alternative option for their employees who have decided not to elect their health benefits with their employer. We can be a resource for them if they are uninsured and are not eligible for Medicaid or Medicare and meet our financial eligibility criteria. We can enroll them as patients at Helping Hands Clinic.
Okay.
And a little bit about what we do for our patients. So we become then the primary care provider for our patient. They can come to us for their annual physicals, for their urgent care, for anything that they would go to any other doctor's office for. And they also have access to our pharmacy. So
Very nice.
in our pharmacy, we are limited licensed, so we can prescribe life-saving medications, antibiotics, inhalers, insulin, all those kinds of things. And so our patients can come to our pharmacy. They can receive their medications for free. So that's
That's very nice.
Yeah, and I feel like we're a wonderful resource in the community.
It's a great resource.
Yes.
Yeah.
And but that program is just another way for us to connect with the folks who don't have health insurance in the community.
And if anyone had any questions about the program or want to know more about it or how to apply, what would be the best way to do that?
They could call us at the clinic, or email me, and I think we can probably put my email address and phone number.
Yes, we'll have it in the description, have it ready to go.
So, but that would be the best way to start that conversation. If that, and that's for anybody in the community who doesn't have health insurance and meets our eligibility criteria, or for any employers who are interested in talking about how we could be a resource for them. And something that we found that's really helpful is that we actually can come and do on-site information programs at businesses for their employees, and we can also do enrollment events on site, so that way the employees don't have to have an appointment at the clinic to become enrolled and do start their paperwork and then also have a first patient visit. We can do that on site with the employer
and meet them where they're at. Very nice.
Yeah, so it works pretty well.
Cool. So also you guys had something with donation medicine information that you want to share.
Yes. So we recently updated our wish list, and these are the things that we come to the community and say it would be really helpful to the clinic and our patients if we had more of these items.
Right.
So if someone was looking to make an in-kind donation, these are the things we need. And right now, just general supplies, we need copy paper. We need bottled water for patients, and snacks for diabetic patients who may have low blood sugar, that kind of thing. We like to keep a little stash of those kinds of things on hand. We're also, right now with cold and flu season coming up, any kind of over-the-counter cough medication, allergy medications, over-the-counter nasal inhalers, and those are really the big things that we need. But we also accept prescription medication donations. But there are some caveats to that. In order for us to be able to safely take those and use those, they have to be has to be a medication that's in our formulary, which our staff can answer that question for anyone who might want to donate medications. It has to be in date, so it can't be an expired medication. If it's a prescription medication, it has to be unopened. So, and then it also has to have been stored properly. So things like insulin and like insulin adjacent medications have to be refrigerated for a certain period of time at a certain temperature, and we have to know that it's been kept that way before we can accept it as a donation. And part of the reason I wanted to bring that up is I know a lot of people in the community have made donations of all kinds of different things to our western neighbors who
Yes.
have been so terribly impacted by Hurricane Helene. And I think those are also good rules of thumb to remember if you want to donate medications, because I know there have been lots of calls for insulin and prescription medications for folks who were not able to access those things.
Exactly.
So those are some good rules of thumb to be able to safely donate medications that can still be used.
Absolutely. It's a good thing to keep in mind.
Yeah.
Is there anything else we need to share with everyone?
Just so with our worker wellness program, I just want to make sure that folks in the community know that we're accepting applications for patients. We're accepting new enrollments.
Okay.
So we definitely have capacity to serve more patients right now. We've actually hired 2 new medical providers
Great.
who are seeing patients at our clinic. We've been able to expand our afternoon appointment availability, which has been really great. So if there's someone out there in the community or a friend or family member who has lost their insurance or who is navigating the healthcare world without insurance, we can be a resource.
Very
So,
cool. And that information will be on the screen to contact you about that, right?
Yes.
And you have a Facebook as well
We
with
do.
all your contact information.
Yes,
If
we
people
do.
can't remember, they see this later and
Certainly.
they're like, so they can look you up on
They
there.
can Facebook, visit our website, or call the clinic.
Very nice.
So
Thank you, Brittany,
Thanks
so
so much
much
for
for coming
having me.
in. And thank you for watching Caldwell County Today.